Hi everybody, welcome to Inside IDB. My name is Stacy Cervenka and I'm the director of the Iowa Department for the Blind. This episode will be longer and in a little more depth as it's a virtual interview featuring two guests.
All right, Lynn, why don't you introduce yourself?
Thanks, Tracy. My name is Lynn Ballif. I am blind, and I'm also professionally a registered dietitian and a certified diabetes care and education specialist, which also previously was known as a diabetes educator. So we can just use that for a shortcut. And I've worked in the area of diabetes for the past 25 years.
So, Bridgit, can you tell us a little bit about you?
Yes, I am Bridgit Kuenning. I have been living with diabetes, type 1 diabetes in particular, since I was 4. So I've been dealing with this for about 40 years now. I was diagnosed in the early 80s, early to mid 80s. Things were very different back then in terms of diabetes management and kind of what the protocol was. And there's been just a lot of really fantastic technologies and different ways of viewing management since that time. And I'm from Omaha, Nebraska.
Excellent. Well, Lynn, can you please tell us a bit more about both your personal experience with blindness and diabetes and also your experience working with people with diabetes?
So I was born blind and grew up using a combination of visual and non-visual skills. And over time, as I've aged, as for many of us, I have gone more towards non-visual techniques. As a kid, I was very interested in medicine, but becoming a doctor was not going to be an option for me. So I actually learned about and then pursued becoming a dietitian. Very early on in my professional life, I knew that diabetes was something that I was particularly interested in because I thought that it was a place where I could make a big impact. And so over the years, I have worked with patients who have diabetes from all areas of life, from children with type 1 diabetes to adults to pregnant women. So that really has been a focus for me. And I have learned so much from the people that I work with, especially related to the challenges of living a daily with diabetes.
Thank you. So, Bridgit, can you tell us a bit more about your personal experience with diabetes and blindness?
Sure. So, like I said, I was diagnosed when I was 4. So essentially my whole life, I've had type 1 diabetes. Um, Type 1 diabetes is actually an autoimmune condition. So, it was interesting growing up, particularly in the 80s and 90s, as a kid, as a teenager, before some of the existing technologies that are now available were out. I always say I'm sure my parents would have loved some of these things to have had around when I was a kid. Um, my parents were it was important to them that health and fitness were a part of sort of our family routine. And I was the oldest, so being diagnosed at 4 wasn't by any means easy for my parents. However, it wasn't a big challenge in terms of, and back then it was very much focused on what you ate, how you ate. Things are different nowadays. But it was just sort of already a part of what our family did. So in terms of like the practical side of it, the daily management, it wasn't terribly challenging to have to adapt to that. And I think I was still awfully young as well.
Excellent. Thank you. So Lynn, what are some accessible tools that either you use to manage your diabetes as a person with vision loss or that you recommend to your clients?
The top things that come to mind are going to be accessible ways to check blood sugars, which would include meters such as the Prodigy Voice or the Rely On Premier Voice, which are relatively accessible. And then as far as like managing medications, especially if someone needs to use insulin, would be either using an insulin pen, or you can use a vial and syringe if that's what your insurance will pay for, with a device called a count-a-dose, which is a little plastic device that allows you to draw up independently the amount of insulin that you need. And then lastly, related to insulin would be insulin pumps, which have a varying array of accessibility, but can also be used by people who are blind.
Excellent, thank you. Bridgit, are there any additional tools that you use to manage your diabetes that you think clients might want to speak with their healthcare providers about?
Not necessarily additional, but I do use a CGM, as Lynn talked about, the Dexcom, which is fully accessible through an app. And I also use the Tandem Mobi insulin pump, which is also fully accessible through its app.
Excellent. So people can when you say it's accessible through the app, you mean that people can access the information and the controls on their iPhone or iPad.
Yes.
Excellent.
On both Google Play and iOS, and yeah, fully, fully accessible.
Excellent. Now, Lynn, so question for you. So what practical strategies can someone with diabetes use to manage their diet effectively?
First of all, I think it's really important that when you have diabetes, that you get a basic understanding of how food intake is going to affect your blood sugars, and to have an individualized meal plan. And the best way to do that is to meet with a dietitian, so that you have a concept of, okay, this is what I'm striving for, or these are the strategies I'm going to use when picking my meals to help control my blood sugars. And then focusing on the amount of carbohydrates that you're eating at each meal. And that amount can vary depending on the person, and also the medication and the way that the diabetes is being managed. So depending on what medications you're taking, you might need to be more consistent with your intake. Whereas if you are taking insulin that you are able to adjust based on what you ate, you do have some more flexibility. So by talking to a dietitian, by talking to your doctor, it'll just sort of help you know sort of what you need to be focused on at each of those meals.
Excellent, thank you. Now, one thing that we work with our clients with here at IDB, if they do have diabetes, is helping them with meal plans that will work for their budget and their schedule. And so what are some tips for people who want to eat healthily, but are busy, or perhaps they're on a limited budget?
I have to say that for everybody, eating healthy can be a big daily challenge. My big tips are, first of all, planning ahead, being able to sort of gather new ideas for meals. I do that personally by following a specific recipe site. So for example, I subscribe to the New York Times recipes. They just get emailed to me, and I can just look through, see if there's anything that I think would be quick and easy and delicious. Also, I follow several influencers who put out recipes. So it's actually how I recently found a new recipe I'm trying this week, which is a white bean and roasted chicken dish, which basically all goes in one pan. It has like 6 ingredients, and it'll be ready in 30 minutes. So that can be really fun. And also, I would say in planning ahead for what you're going to need to purchase for that week, so that you're only buying foods that you're going to consume. Really minimizing our food waste is going to cut down on the amount of money that we have to spend. And then lastly, I would say thinking about food budgets is to understand that not everything needs to be purchased that is, fresh and organic, and, that $12 box of cereal is not the only choice that can fit into a healthy diet. So kind of taking each category of food and looking at what you can afford, like vegetables. Fresh vegetables are going to be more expensive, especially if they're out of season. So looking at frozen vegetables, which are equally as nutritious. And then if that is above the budget, it is perfectly acceptable to use canned vegetables just to decrease the salt intake. You might want to just drain those vegetables, rinse them off, and then cook them in some fresh water. So there's lots of options. We don't have to always be focused on, well, this is the quote best option. And if I can't afford that, then, you know, in some way I'm failing, because that is absolutely not true.
Thank you. That's very helpful. Now, Bridgit, sometimes our clients are told that because they're blind, they can't manage their diabetes independently, and they are going to need someone who's sighted to measure their blood sugar or give them insulin shots. So, what are some strategies you've used when you've encountered healthcare professionals who have doubted your ability to manage your blindness non-visually?
Well, I've been just very fortunate in that I've not had many encounters with people who didn't, think I could do it on my own. But the, one or two times that has happened, again, I'm fortunate in that I just sort of have the personality that you can't really tell me what to do. I'm very comfortable in advocating for myself, speaking up for my needs. And I don't know if I want to say educate, but, just letting people know that it's okay. I know how to do this. I've been doing this for X amount of time. So I would just say, just get comfortable with being able to speak up for yourself and advocate for yourself. That's going to be your best option. It can be very uncomfortable at first. But, if you really want to be able to do this independently and you know that you can, it's going to be important to be able to express that to people, particularly medical professionals who might have doubts.
And if you're not sure how you can manage your diabetes independently with vision loss, Lynn, what would you suggest that people do? Who would you suggest that people contact?
So there are a lot of resources available. A couple of my favorite places to find that would be the American Foundation for the Blind has a vast amount of information about managing diabetes with vision loss on their websites.
And that's afb.org?
Yes.
Okay.
And so do the blindness consumer organizations, the National Federation of the Blind and the American Council of the Blind. I would say, though, for sort of all of those resources, some of the information may be older. So it might not be the most up to date, but it will certainly give you a basic understanding that you can absolutely manage your diabetes independently, regardless of the amount of vision loss that you have.
Excellent. And so that's for most people, that's www.afb.org as an American Foundation for the Blind. And you may also be able to find information at www.nfb.org or www.acb.org. So, Lynn, another concern that some of our consumers have is that blind people are at increased risk of type 2 diabetes. And sometimes that's due to living in a food desert or having less disposable income to buy healthy food, or less for some of our consumers who may not have received training in orientation and mobility or cane travel, getting to the gym, going for a walk, going for a jog, remaining physically active, it can really put them at an increased risk of type 2 diabetes. I've also heard that people who have gestational diabetes when they're pregnant are at an increased risk of type 2 diabetes. So what can people in our community who don't have type 2 diabetes do in order to prevent this onset?
So the most important thing in diabetes prevention is, first, knowing what your risks are. And there are numerous online tests that you can use to assess your risk. They're basically similar. It's just that they're offered by different websites, like the Centers for Disease Control, or the American Diabetes Association. So the easiest way to find those is to just do a Google search for diabetes risk test and take a look at them. And it will basically give you a score and tell you, are you at low risk, moderate risk, or high risk? The second thing would be to talk to your medical provider and ask if your particular circumstance would qualify you to have a blood test done just to check and see where your blood sugars are at. So there actually is a level of a 3-month average of blood sugars. It's called a hemoglobin A1C, or A1C for short, that your doctor can do. And if your number is between 5.7 and 6.4, then you are in the category of prediabetes, which means that you now have changes to blood sugars that put you at risk for progressing to diabetes. At that point, sort of the key is basically having a modest weight loss and increasing activity. And there are programs throughout the country called the Diabetes Prevention Program. I was actually looking last evening, and in Iowa, there are programs offered through the health department in different places, whether it's hospitals, medical clinics, or even at the YMCA. So you can look and see if there are programs in your area. It's a year-long program that includes both sort of meetings, group meetings for education, but you also get lifestyle coaching to kind of help you achieve that goal of the modest weight loss and increased physical activity.
Excellent. So thank you both for being here today. We've learned a lot, and I know that our clients are going to appreciate some of the information you shared. So one thing I wanted to ask each of you is if you could give one piece of information to people who are blind or low vision and beginning to learn to manage their diabetes independently, what would that advice be?
I would say that anything is possible. Don't let your vision loss or your diabetes hold you back from doing what you want to do.
Excellent.
Yeah, I would definitely agree with that. Being blind or low vision doesn't have to stop you from being able to do these daily tasks, including managing diabetes. I wasn't always blind, and then I became blind in my 20s. And so I've been doing this for more than 20 years now as a blind person. We all have different abilities and bring different, journeys into our life and experiences, but it is more than possible to do this. Just have to learn what you need to learn. And I would also just say, take a breath. It'll be okay. You don't have to be perfect at anything, in the beginning or at the end for that matter.
Well, if you are either recently diagnosed with diabetes, or perhaps you've been living with diabetes for a while and now you're experiencing vision loss, or you are a blind person who is interested in maintaining a healthy lifestyle in order to prevent the onset of diabetes, we are here at the Iowa Department for the Blind to help you learn the skills to prepare healthy and cost-effective meals at both our training center. We offer in-home services, and we offer monthly retreats around the state of Iowa for both youth and adults. So please feel free to reach out to us at the Iowa Department for the Blind and let us know how we can be a part of your journey.